Hello everyone, we are Dale
and Russell.
Today we are discussing lung cancer, which remains a primary global health threat in 2026. This disease begins in the lung tissues, specifically within the air passages. There are two primary types we need to distinguish. One, non-cell lung cancer, which is NSCLC, and it accounts for 85% of the cases and typically grows and spreads more slowly. And then we have small cell lung cancer, SCLC, accounts for 15% of cases. It is highly aggressive and spreads quickly. Here's a chart that explains NSCLC and SCLC. You can pause the video if you'd like to see the full chart. This chart illustrates that breakdown. As you can see, NSCLC is by far the most common diagnosis. Regarding symptoms, patients often experience a cough that worsens over time, shortness of breath, chest pain, and a hoarse voice, unexplained weight loss, and coughing up blood. Unfortunately, these symptoms often do not appear until the cancer is in an advanced stage. Is it genetic? While about 10 or through 15% of cases are linked to specific gene mutations like EGFR, most cases are not inherited. Instead, they result from accumulated cell damage over time. And thank you. Tyler will explain the risk and development next.
Thank you, Dale. Lung cancer develops when the DNA within lung cells undergoes specific changes. These mutations cause cells to grow out of control, eventually forming tumors. This process usually begins in the airways due to chronic exposure to irritants and advances over many years. In 2026, we see that lung cancer primarily affects people over the age of 65, with the average age of diagnosis being 70. While men historically were more affected, rates among women continue to rise. This year, we expect approximately 229,000 new cases in the US, representing a 1 in 19 lifetime risk. This info chart highlights the leading risk factors. I'll read some of the factors that can cause lung cancer. Number 1, patients with lung cancer, often 85 to 90%, smoke cigarettes, which contain a cocktail of toxins that damage DNA directly. Number 2, 10 to 15% of people that were diagnosed with lung cancer suffered from radon gas, which is caused among non-smokers. The third one, includes other factors such as secondhand smoke, asbestos, air pollution, and family history. The good news, quitting smoking can cut your risk in half within just 10 years. Russell will now cover how we treat this disease.
Thank you, Tyler. Lung cancer is treatable, and the outlook is best when caught early. Our current medical treatment plans include 1. Surgery, 2. Chemotherapy, 3. Radiation, 4. Targeted therapy, and 5. Immunotherapy. As this line graph shows, the 5-year survival rate varies drastically by stage. While the overall rate is 22%, it jumps to 60% if the cancer is localized. If it has spread to distant organs, the rate drops to 7%. Treatment does come with side effects like nausea, fatigue, and hair loss. However, research is advancing rapidly in 2026. We are seeing incredible progress with the CAR-T therapies, precision medicine, and better supportive care like the NK1 inhibitors for nausea. Here's a quick visual explaining the survivability for a lung cancer stage, starting from stage 1. In summary, know your risk. If you're over the age of 50 and have a history of smoking, talk to your doctor about a low-dose CT screening. Early detection saves lives. Thank you for watching.